Hi everyone, and in this episode we're going to talk about Finasteride and Dutasteride. What happens if you're taking this medication and you're still experiencing hair loss?
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to the Hair Loss Show. So when we look at people that are suffering from androgenic alopecia, one of the things that we will look at doing is starting on medical therapy. And one of the things we start on are 5-alpha reductase inhibitors. So that blocks the conversion of testosterone into dihydrotestosterone. And there are two types essentially on the market right now. There's a type 2 blocker, which is called Finasteride, and that's the most commonly used one. And then there's a type 2 and a type 1 blocker called Dutasteride. And generally, and we've done videos on this on these topics before, but in my experience, what I generally do is I start people on Finasteride, and if they're still experiencing hair loss on a reasonably maximal dose of Finasteride, I'll add in Dutasteride as well. So the question is, well, what happens? Because there are individuals who you will start on both medications, who are on both Finasteride and Dutasteride, but are still progressing in their hair loss. So what do you do? Well, that's really unfortunate, but you need to manage that scenario. And I cannot stress how important it is that you make sure that you get thoroughly assessed and have a management plan that is specific for you, and you speak to someone who's skilled at managing hair loss. So the key there, all right, so if you've got someone who, despite being on both a type 1 and type 2 blockade of the 5-alpha reductase enzyme and is still losing hair, it probably means that they've got quite a advanced form, or an aggressive form, I should say, of androgenic alopecia. That means that their genetics are such that they are still losing hair. And that speaks to a larger point, okay, which is probably a conversation that's beyond the realms of this discussion here, which is that potentially DHT is not the total answer as to why androgenic alopecia is taking place, or why miniaturization in androgenic alopecia is taking place. But in that scenario where you've got someone who's persistently losing their hair, so how do we manage that? Well, the key is to look at other options, all right? So you've maximized your therapy on the blocker side of the equation. So the other side of the equation is that what we need to look at and try and implement strategies from that. So the stimulation therapy, and that may include things like minoxidil, so maybe topical minoxidil, maybe oral minoxidil. Look at low-level laser therapy. Right, low-level laser therapy, again, we've discussed this in the past. It can be used to stimulate hair. PRP, platelet-rich plasma, or these other regenerative therapies are there to try and reduce inflammation in the scalp, also promote growth factors, promote blood flow, blood supply to the area, and therefore try and improve the thickness, the stimulation of the hair. In this particular scenario, transplantation is probably not the answer, because you're sort of fighting an uphill battle if, despite medical therapy, you're still losing hair. So it's trying to maximize the other therapies, see if you can, through those channels, gain stability, and then try and stabilize this process. All right, so I hope you found that useful. Thanks again for watching. Please remember to like and subscribe to the channel, and we'll see you on the next episode. Thanks very much.